Chickenpox, also known as varicella, is a highly contagious disease. Varicella-zoster virus causes chickenpox when it infects person first time. After first infection, it stays in the body and causes lifelong latent infection of sensory ganglionic neurons. Reactivation of the latent infection causes herpes zoster shingles. Chickenpox is an airborne disease which spreads easily from one person to the next through the coughs and sneezes of an infected person. It may be spread from 1 to 2 days before the rash appears until all lesions have crossed over. Before the introduction of varicella vaccine in 1999, varicella was an almost universal communicable infection of childhood. Signs and symptoms. Varicella lesions often appear first on the scalp, face, or trunk. The initial exanthem consists of intensely pruritic erythematous macules, red, small dots that progressing over 10 to 12 hours through the papular stage to form clear fluid-filled vesicles, small bumps, blisters, and pustules. The distribution of the rash is predominantly central, with the greatest concentration of the trunk and proximally on extremities. Ulcerative lesions involving the mucosa of the oropharynx and vagina are also common. Many children have vesicle lesions on the eyelids and conjunctiva. The average number of varicella lesions is about 300, but healthy children may have fewer than 10 to more than 1,500 lesions. Hypopigmentation or hyperpigmentation of lesion site persists for days to weeks in some children, but severe scarring is unusual unless the lesion were secondary infected. The differential diagnosis of varicella includes vesicular rashes caused by other infectious agents, such as herpes simplex virus, enterovirus, monkeypox, rickettsial pox, staph aureus, and drug reactions. The condition usually resolves by itself within a week or two. The rash, however, may last for up to 1 month. Diagnosis varicella and herpes zoster are usually diagnosed primarily by their clinical appearance. Laboratory evaluation has not been considered necessary for diagnosis or management. Treatment. If acyclovir by mouth is started with 24 hours of rash onset, it decreases symptoms by 1 day but has no effect on complications rate. Use of acyclovir therefore is not currently recommended for individuals with normal immune function. Children younger than 12 years old and older than 1 month are not meant to receive antiviral drug unless there is another medical condition which puts them at risk of developing complications. Treatment mainly consists of easing the symptoms. As protective measure, people are usually required to stay home while they are infectious to avoid spreading the disease to others. Cutting the nails short or wearing gloves may prevent scratching and minimizing the risk of secondary infections. Paracetamol, but not aspirin, may be used to reduce fever. Aspirin used by someone with chickenpox may cause serious, sometimes fatal disease of the liver and brain. Reye syndrome. Foscarnet and cidofovir may be useful for treatment of acyclovir-resistant varicella infections, but consultation of an infectious disease specialist is recommended.